So, hi everyone. Welcome to another episode of Unpacking Possibility. I'm your host, Tracy Stein, as always. I'm so happy to be here with you. You're going to love our guest today. I'm going to read a little bit about her, and then she's going to tell you more about herself and her work. But my guest today is Dr. Elizabeth McGinley. She is an owner and partner in Montclair Performance Health and Chiropractic in Montclair, New Jersey. Dr. McGinley studied exercise physiology at Rutgers, and she also has a bachelor's degree in animal sciences. Dr. Liz, as she's affectionately known, is an internationally certified chiropractic sports physician. She'll tell you more about that as we get into the interview. But she specializes in chiropractic sports medicine, rehabilitation after injury, and improved performance. She also has a master's degree in human anatomy and physiology instruction. And she's also completed her 200-hour yoga teacher training. Last but not least, and of course, this is only the tip of the iceberg, but Dr. Liz has experience assisting with level 4 to 10 gymnasts, dancers, and collegiate soccer players. So without further ado, Liz, welcome to the show. So nice to have you here.
Thank you for having me. I completely forgot about the yoga cert when you said it. I was like, "Oh, right."
So Liz, I know there's so much for us to get into today.
Yeah.
I know, because we've talked before this podcast,
hmm
and many times you have an interesting journey. You became a chiropractor kind of by learning about it through an injury you sustained in your work as as a veterinary technician,
Yes.
where tell me if I get this right, you were bitten on the face.
Yes. One of my
And
patients bit me.
right, and we can understand that they get so
Yeah,
nervous.
absolutely. She had Lyme's disease. It was a 9-month-old boxer, and she had Lyme's disease. We didn't know at the time. So when I went to pick her up, she was painful, and she bit my face.
Yeah.
Um,
I've had that happen too, by the way, so it's
yeah,
not that unheard of.
yeah.
Not quite to the same extent, but you had facial nerve pain and you had changes in the movement of the muscles in your face as a result of this injury?
Yes. So the nerve, when they gave the lidocaine to numb the area to put the stitches in, the nerve went excited or hyperactive, and it created a feedback loop of contraction of the muscle around the eye and around in the cheek. And then it would fire off random pain patterns that weren't there. And sometimes it was simple, like feeling hair on your face, and sometimes it was more like matches. And I went to back to the plastic surgeon who fixed my face, and he's like, "Oh, it's just part of healing." And then, "Oh, you have PTSD," is what I was also told. So I was given Xanax and sent for therapy, which helped. I'm not gonna say it didn't help, but it didn't stop it. And then I was going to a chiropractor at the time, and they were very like, "Sure, we can help you." And they did a whole therapy for fascial release, nerve treatment to help the nerve regrow without having problems, and then balancing the muscles and the joints so that I wasn't constantly putting pressure in that area.
And that really set you on a path to saying, "I wanna study chiropractic medicine,"
Absolutely.
because you had a nursing degree.
Yes.
You had, a bachelor's in animal sciences, you had been working
Yes.
as a vet tech, you had been interested in anatomy and physiology and healing for a really long time.
I was on my way to being a veterinarian. I was going to apply in October. The injury happened in July, the last week of July. So it was right at the end where I'm like, "Oh, maybe I shouldn't do this. Maybe there's something else out there." And then through the journey of healing and the next 6 months, I found chiropractic. I dove both feet in and got in March of 2009. And then the program is very quick, which is nice because I was in my 30s and I wanted to get done quickly. And here I am. That was 2012. I met my husband at the end of the program. Um,
And you share a chiropractic
I
practice
sure,
with
yeah,
him, Dr.
I do.
Christopher Hobbs.
Christopher Hobbs. We've been together since 2015. We both got our sports. It's now called ICCSP, International Chiropractic Sports Specialist Physician, I believe. I did it when it was run out of Geneva, so it's French. So it's called FIX, or Federation du Chiropractic International Chiropractic. Same thing. It's I think 600 hours, and you have to specialize in at least one sport. You can specialize in up to, I think, four. It's similar to a residency for a standard doctor, but it's extracurricular. You're not getting paid to do it. You're paying, and it's a lot of volunteer work. You're at the sidelines. I went, I think the youngest I was at was like 9-year-old gymnastics. I was at their meets just to help them out. I've been to semi-professional sports like soccer, CrossFit, and the coolest one was rodeo. We did rodeo. We were helping the
Helping
rodeo,
rodeo riders
helping rodeo riders and the clowns too,
and
and
the
the
oh
clowns.
my goodness. Well, and I think I wanna tie that back into,
Mhm,
you know, what most people don't know if they aren't chiropractors themselves or haven't
mhm,
worked adjacent to the field is that, chiropractic medicine really looks at the body as a system rather than as so compartmentalized. And again, I have great respect for modern medicine, but when you were talking about your own injury and having nerve pain and other asymmetries and changes in your movement, there wasn't a framework for looking beyond the site of the actual injury. And chiropractic and your additional sports medicine training really seems to have provided that framework. Is that accurate to say?
absolutely. When I was being trained in the sports world, they of course use sports analogies. I went into this as the sports thing a little bit differently. I shadowed the first chiropractor to ever go to the Olympics. His name is Dr. Phil Santiago. He gave me the opportunity to get the sports med certificate because of that. And I was not a sports person. I don't I like sports. It's not bad. Now that I've watched enough of it, I actually enjoy it. But back then and most of my life, I was kind of a nerd and I didn't really do a lot of so I didn't have a sport to really resonate with, and which was kind of blank slate and nice because I didn't have bias toward any one sport or another. But when I started working with the athletes, Dr. Phil Santiago said, be the quarterback your patient needs. And I didn't understand that at the time because what does the quarterback do? But what he meant
You're
was
not
you need
alone.
right. Okay. I throw a ball. I'm gonna throw a ball at them. Okay, no. What what he meant by that was be the answer person and the person that helps integrate everything. So if this person comes to you with pain, you are going to help them get out of pain. And sometimes you are the person to facilitate that. Like the body's going to do what it needs, but you're going to push it in the right direction. Sometimes it's not going to work, and you have to be humble enough to find them the help to get there, and being able to integrate other modalities, other practitioners and specialists is important. And that's how you bring somebody to the better place for their physical and then emotional place.
Yeah, it's such a good stance to take, I think. My work has always been very integrative, and
Yes.
just given the patients I've been referred over the years who've often had very complicated, physical health histories, it's important to kind of think out of the box, and it's important to think, "Okay, if I can help this person, great, and if I can't, who's the appropriate referral or the series of referrals?" And I think that really does go back to the idea of the body as a system. And I wanna just tell people that the way I met you is I literally did an internet search because I've had back pain on and off, mostly on, it could be for like 35 years or more, and I've been to other chiropractors and, and I've gotten some relief from a lot of different approaches, and, I've gone and gotten massages, but the muscle pain has been so difficult to manage. And one of the things that most people wouldn't know, I think people think about chiropractic as back cracking, and that's kind of it. Because if you're not a chiropractor, it's probably a very simple understanding.
Yeah.
But most of what we do that has alleviated my pain has been your looking at the imbalance in my, entire skeleton and musculoskeletal skeletal system and stretching the muscles that have gotten bunched up. You're gonna describe it better But and the reason I bring all this up is because there are other things, there are other areas of the body that can be painful that people would not understand that this approach could help.
So what you're describing, the integrated or the whole body system, it's biomechanics. So this can get very confusing because we know anatomy and we know the human body as that like was it Vitruvian man? We see it flat on a piece of paper. Knowing how it moves through space and takes on load and force, that's the training I've had both during the traditional program and then even more so during the sports part. It's the kinesiology that I've studied, and that tells you what the body, what the load bearing parts are, and what the balancing act is. We as animals have certain predilections to do things where we walk upright, but we slouch like we used to as primates. And that's not great for us now because we chose to walk upright. We thought that was a really good idea a few 100,000 years ago. And now when the forces go through our body, it has to go down the spine and out the legs and then back up every step, every move we take. And what you were describing with the fascia and the muscles, they are part of the shock absorption or they take the load. The bones are there for structure and they take force because it's strong. But when we are moving, it's bouncy tissue that takes the tensile strength. So if you're sitting unevenly, if you're in the car with one leg out and one arm on the steering wheel, that twist and torque, adds up, and it can add up bit by bit over a day or over months, years. It'll eventually stop being compensated, and that's when the body's like, I'm going to raise a flag here, and this flag is the pain, and the nervous system says not great. And it's the princess and the pea, where it could be one small thing that everything has to compensate for, and you have to unwind it back to that little pea spot to figure out how to get to the full arc of recovery.
So I wanna just kinda paint a picture for people too listening, because some of the terms like the force and the torque and things like that might be they might be familiar with, some they might not, but, it sounds like what you're describing are we often do things that are, first of all, sitting all day, hunching forward over our desks, crossing our legs, driving where it puts the body in a state of imbalance, and it
Hmm.
makes it harder for our bodies to absorb the shock of just moving. The weight of our bodies moving through
Hmm.
space against the earth. People don't think about that. Um, the other term you mentioned is fascia, like the envelope around all of those
If
tissues.
if you picture a piece of meat, lunch meat in a Ziploc bag, the Ziploc is the fascia, the meat is the muscle, and when we move, the take two Ziploc bags, two pieces of meat, and slide them across each other. That is how any movement happens in a limb, against the spine. It's muscle inside of a bag or inside of packaging gliding across itself. The glide is very important, and anybody who knows about beauty or aging has heard of hyaluronic acid. And
Yes.
so hyaluronic acid is in our skin. It makes it look plump. It makes it look like full. It also exists everywhere else in the body to help with glide of tissue. If it gets under pressure or inflamed, it changes consistency and it goes from smooth, glossy gliding to now cold honey, gritty, crunchy, and then the muscles around it feel it and they start to bind up. And the body doesn't like wasting energy. So that activity of binding, eventually the muscle's like, I'm not going to waste energy. I'm going to lay down connective tissue. And that is how you get a knot in your muscle. The fascia starts the conversation, the muscle answers it, and now you have that knot on your shoulder that never goes away.
Yeah. No, and it's painful, and what you were saying
Mhm.
earlier about the princess and the pea, I'm thinking about how many nights it feels so hard to sleep because it's impossible to get comfortable, or there's that knot that, and I think a lot of people in the modern era know what I'm talking about. That
Absolutely.
knot or that tension around the spine where you're like, "Ah, my upper back," or maybe it's my lower back, and no matter what you do, It's just like a massage might take the edge off, but it doesn't get there, and what you're trained to do is get much more deeply into that muscle and start breaking up those knots, right? Because
Hmm.
again, I wanna emphasize to people, I have nothing against regular chiropractic adjustments, but
It has a place, yeah.
yeah, but for me, this has done more to align my body. Like, I wanna put this out there as an example too. If anybody has ever gone to get a pair of pants hemmed, maybe tall people won't get this, but yeah, I'm not that tall. So, but I can't tell you, for years, people were like, "Your one leg is like an inch or so longer than the other." Well, that's that postural imbalance that's been reinforced over time that creates other problems throughout the system of your body. Is that fair to say?
So pretty much every visit I check levels, and sometimes it's where the feet are and what the feet are doing. I check the hips and the shoulders, and then at the TMJ. Those are the horizontal portions of the body. That's where the foundational load will bear. So if we're building a Jenga, that's the horizontal pieces so that the it's not going to fall over. If there's a problem with the shifting of the limb or the region, that's part of what I have to tailor to you. It's not going to be the same for everyone, and that's part of what I learned. Like a lot, I've been to chiropractors before, and I know it is a place. Wellness and traditional osseous adjusting has a place in the world, but the people I correct and the people I work with, they need another layer, and this is what we're talking about. Um, if you just adjust a spine and send them out the way, the fascia is going to take over, the muscles are going to remember, and it's going to yank that bone right out of place. And now you're back where it's like, I felt good when I left, but it only lasted like a day. And that, because that's where I learned to integrate those levels. Main one is the pelvis. What you just described is pelvic unleveling. It can be from sitting the wrong way for too long. It could be because we're short. Under, if anybody under like 5'5" can't sit in in a chair without having little dangle feet, and
That is
it's
true.
and what do? We tuck our foot underneath, we slouch back. Those are all compensations to stop having to waste energy for, if you don't fit the chair will, you'll have to, the chair is going to win. It has more, it doesn't have to waste energy to sit there. You have to waste energy to sit there, and your body's like, nope, I'm not going to do that anymore. I'm going to find compensation.
But that
So
can create imbalance over time.
it can create an imbalance, and once one level goes off, it becomes a cascade or a kinesthetic chain, where now you have this unleveling, but you have to move through space. And with that unleveling of your hips, one leg is short, one leg is long, every step you take. And now your shoulder has to compensate. You need to look at the horizon, so your shoulders rotate, your jaw tenses, your shoulder can fall forward, your knee can turn inward. These are all compensations that then, those might be more painful than the original problem. You know, I don't have a back problem. I don't feel it in my back. It's really, that's the start of things. The cascade of all the other compensation permeates out through the spine because of it.
So I'm having some thoughts.
Hmm.
I don't know, some of the audience might know and some might not that, I'm fellowship trained in pain psychology. Back in the
Yep.
day, that was like a completely rare thing. It's still not that common,
Hmm.
but my fellowship was done in a department of anesthesiology on a, like, chronic pain service. And the reason I'm bringing that up is because if you have, like you were talking about, okay, so if your hips are not level and your legs are therefore not level, and now your shoulders are a little bit off and your spine's a little bit off, and maybe you're tensing your jaw, you may go into that chronic pain clinic and say, I've got TMJ, and you might have it for other reasons, I'm sure. Or, I've got this awful shoulder pain and nothing seems to work. And so you might get injections, to try to, ease the
I
pain there.
see
And again,
this.
and
Yes.
it's not that that's never appropriate, but it's not solving the problem that's causing it.
Digging, going back to where we were talking about it being the quarterback, asking more questions and digging deeper is one of the things I was trained to do as a nurse and as a veterinary technician. I can't ask my patients when you're talking to a dog, you're not going to get answers, but you have to ask the owners to tell you about the dog to get the answers. And in a way, I learned to look further and further out. I had some really interesting cases as a vet nurse, a veterinary technician, and one of the most unique ones was there was a cat that was in for seizure disorder that over this is a longer story over a tremendous amount of money and medicine we found out that it had, do you know what a foxtail is? It's a burr,
Yeah.
like it's from a plant. It had a foxtail embedded behind the eye.
Oh my
Ha-
god. No one
and
knows how that happened.
it's an outdoor cat. It got something, but from pressure in the eye, pressure, and it backed up. It took so much conversations of like, oh yeah, he got out. Oh, he was out in the field. Finally, we were doing like a. He was put under anesthesia, and while I was recovering him from anesthesia, I saw the eyes were not level. This is before chiropractic, but you can't stop yourself. And I went to go clean like the goo out of his eye, and it pops out. The little foxtail falls right out, and then it became a we have to get him back under anesthesia and correct more things. But that type of education and experience gives me the capacity to look outside and look as a whole system integrating into itself. Modern medicine, especially current modern medicine, specialties are more they're more ubiquitous. Everybody is going very specialized. So not only are you an orthopedist, but you're a shoulder orthopedist. I'm not going to touch a hip. I'm going to you go to the hip guy. Dermatology. I'm dermatology, but I only do preventative dermatology. It's specific, which is great because you can learn. They can learn really well. They can do the right thing for the right problem. They. It's difficult to get them to look outside their specialty. Um, there's also a healthcare reason for that too. The specialties do get paid better. So I'm not saying that this isn't just the education is different too. So it's I saw the need of keeping people as a whole unit and not breaking them up into one problem each day or each time. It's better to answer all the questions somehow as you can. And if I don't have the answer, I will definitely send them to that specialist who knows what they're talking about.
Yeah, and I think what you're talking about really, I think, is good practice for anything, whether in healthcare or not, and it's being
Yeah.
curious and open-minded and being willing to think outside of the box. I wanted to talk about some of the things that can benefit from this approach, some of the issues, again, that are really hard to treat, and they're unfortunately not uncommon. So, like irritable bladder, and I know that there are different causes for that. Some are very internal, like interstitial cystitis. But, you know, like we had talked about it, the
Mhm.
pressure from some either the fascia or the misalignment of things, migraines, you mentioned TMJ, temporomandibular joint disorder. I had other things on my little list, but I think people get the idea. I mean, even urinary incontinence. And again, I know that there are other reasons for that, especially in certain age groups, but there are ways to take the pressure off and
Yes.
retrain the body.
Yes. So what you were describing is the non-traditional, like no one's going to necessarily say, I'm going to go to a chiropractor for I had that this past week. I had a person come in and she usually gets like ribs and mid back work done. And she's like, can we go easy today? I'm having like this is the third day of a really bad migraine. I'm like, do you want to work on the migraine? She had no clue I could work on her migraine. I've seen her for at least a year. So I don't advertise it because it's kind of hard to understand as like an advertising, like come in for your headache. The reason the that headache treatments or migraine treatments are helped by fascial work and mobilization is if it's an external force that creates the migraine, if it's postural, there's four types of migraines. Uh, Ocular, where most of it is from visual, like sitting in front of a computer for too many hours, having the wrong light. That could be hereditary. It could be environmental. Having like overhead lighting is awful and it triggers it. Um, Complex migraine, which is many different factors, blood pressure, hormones. Cervicogenic migraines are where I go, and I usually apply all of the cervicogenic treatment protocols. And if it doesn't back it away, then I'm thinking it's another version of it. Tension headaches are cervicogenic. Cervical means neck, genic means generated. So the headache that you're feeling by your eyeballs and around your hairline is started at the base of your neck and rolls upward, almost like behind the ear and into the eyeball. That is a postural issue in its foundation. And the pulley system that keeps our 8 to 10 pound head upright and looking at the horizon becomes imbalanced. And there's muscles that go weak or go sleepy. They don't listen and they fall asleep because they're just not getting enough input. And then there's ones that overwork or hyper react and lock up and don't turn off. Now, underneath all that, there's blood vessels so that the blood flow gets involved and it gets constricted, and that constriction can lead to a furthering of the migraine. So there's a ton of treatment that can be done for that type of issue. It's not, and it doesn't, honestly, I usually don't jump to adjusting a neck that has a headache just because force the body, and goes back to, this is the overarching thing, the body reads force as a threat. Like, if I'm going to push you down, you're going to fall, you're going to be like, ouch, that hurt. If I put force with my hands into your body in the wrong way or the wrong time, is the body going to react to that as a benefit or a fear response? I gotta measure that out per person. I can't just apply the same force to everyone every day. So a migraine person who's already really tight and bracing for the headache, I can't push them and expect the body to be like, okay, that's cool.
Right.
So
I mean, when we feel like something is
mhm.
gonna be painful, we brace, we clench, and that can absolutely make things worse. Um,
It also reinforces the problem. Like, it validates the body's internal red flag, like, yep, I was ready for this, there's another one coming. And then the brain keeps score in that fashion, and then the fascia holds a little tighter and makes a couple more knots, and then makes the problem a little bit more harder to fix.
and then in that event, some of the sports medicine exercises or certain yoga stretches are things people can do on their own to
Yes.
help rebalance the body, stretch what's tight, gain
Activate.
support and
Yeah.
flexibility, and, do you
the,
wanna
the
talk a little bit about that?
the two halves, when something goes asleep, it's either because the nervous system said, I'm going to pull away from you right now. And there's certain muscles that we have that are really powerful muscles. And you can say, make a bicep, kick your leg. Those are larger muscle groups. The tiny muscles closer to the spine are stabilizers. The last time anybody recognized those muscles or said, hey, I have them, if you slip on your socks and overcorrect and you're like, whoa, I saved myself, that is your spine stabilizers snapping on and off and keeping you upright. It's the only time we should notice them. When we have decreased movement patterns, or even just that, I feel like I'm like 80 years old and I can't move, that feeling is the muscles holding tight and they're not getting the cue to turn off. The opposite, it's that I feel like my back's going to go out at any minute. That's the muscles, those spine stabilizer muscles, turning off and staying off. And it's a response to pain and injury. The nervous system does it to help balance things out and downregulate so that it's not getting too much information all at once. But the correction that you're talking about is to turn those balance muscles back on and pull them back into a more stable place, like reminding them, hey, there's a place where you're not going to be in pain. It might be 2 inches of range of motion, but there's still no pain there. And we're going to start and grow from there. So it can be very simple exercises, just turning off, feeling muscles we haven't felt in a while. Cobra pose helps with
And
text
yoga.
neck. Cobra pose in yoga is a good muscle activation and stretch to reverse text neck. So that forward folded, the thinking man statue that we
Yeah.
assume when we're on our phone too much, that posture can be reversed by doing cobra and just doing a pec stretch. like using the doorway to open your arms up. Both of those can help like 85% of the population. The rest might have the shoulder issues or dysfunction.
That's so helpful, and it's something anybody can do. I wanna go back to only
Mhm.
because right
Yeah.
now there's so much in the media in a good way about, women, especially women of a certain age,
Mhm.
postmenopausally, and some of the things we briefly alluded to, like, bladder incontinence or frequency or discomfort. Those things do worsen with postural imbalances and tight fascia, but also from hormonal changes. What is a stretch that somebody could do for that? Because people don't like to talk about that. People don't like to go to their provider and ask. Their regular MD may not have
Not
something to
really.
offer other than maybe a medication to make the bladder less sensitive or overactive. Is there a movement at home somebody can do to take pressure off the bladder?
There's a move to release the pressure on the urethra, which is the tube outside that leads to the outside of the body. So the bladder sits inside. It's got a lot of pressure sitting on top of it. If it gets pulled downward, either by weak muscles of the floor of the pelvis or by the inner thighs, they weave up and into the pelvic floor. If they're tight, they're going to pull down. So just doing a simple straddle stretch. Um, I'm going to use the Sanskrit word. It's called Janu Shirsasana. It's a you one leg out, one leg in, one leg bent, or a
On the
simple
floor?
on the floor, or a simple V stretch would open up the inner thighs. Pigeon pose, if it's comfortable to get in, is also a good one because you get the stretch in the forward and backwards position. Um, Opening up the hips, so anything that's labeled hip openers will also help release the inner thighs or adductor muscle group. That will help stop the pull of the muscle on the urethra, which can that's a lot where if you have the jumping or running or sneezing, some of that could be weak abs, tight weak floor and tight inner thighs. It's just everything goes in one direction and there's nothing to stop it. Um,
So feet together on your back, on the
mhm.
floor, feet together,
Knees
knees
out.
relaxing out. That is also something that could
That's called
relax
body.
this muscle.
It's called Baddha Konasana in yoga. It's also called butterfly pose because you create little butterfly wings with your knees and you can flap them. At any point, if it hurts, don't do it because it can pull too hard. But that feet together, knees falling out, and on a flat surface, that can be a restorative pose. You don't have to try hard with it. If it hurts to keep your knees up in the air, you could put pillows underneath it to make it more restful. It's about getting tension and reconnecting with a part of the muscle body that we don't usually pay attention to. The inner thighs are helpers. They're not the muscle group that we think of when we say, "Hey, I'm going to move through space. I'm going to walk and I'm going to work my adductors." They're a helper, not a doer, if that makes sense.
Okay. No, that's good to know. So, upper back pain, you already mentioned kind of standing at a door. On
Hmm.
on video, somebody could see that I've got my arm stretched
Yeah.
out as if I'm holding a door frame and turning my
I
body away from it.
Yeah.
So if you're listening
Okay.
on audio only, feel free to head on over to the YouTube version.
The exercises all involve activating the muscles between the shoulders because they stretch out and weaken like a rubber band that's held too tight. They're called the rhomboids. There's also a middle trapezius muscle, but those muscle groups stretch out, weaken, and they seal themselves up against the rib cage. So if somebody comes up and gives you a back rub on your shoulder by your shoulder blades, you're like, oh, that feels really good. It's not necessarily because that muscle's overworked. It's because it's been stretched out. Now the blood, when you stretch the muscle, you stretch the blood flow. Blood flow decreases. So now there's less blood, less healing, less repair. That's how the knots start. So when you're rubbing it, bringing blood back, and that's going to make it feel better. It's not going to fix the problem though. You need to bring the muscles back together by activating. And that's why cobra pose in a retracted or pulled together shoulder when you're on the floor, you'll feel the muscle there engage and reset the system. Uh, the fancy term for everything that we're talking about is called upper cross syndrome. It is if you're looking at the side of a person and their nose is facing to the right and their back is to the left, that makes an X. And what we just talked about is muscles working too tight and muscles working and not working. Creates an X pattern. I can list out the muscles, but it's not like I'm going to quiz everybody at the end of this. So
There's a
it
quiz.
there pop quiz, guys. Um, but that forward when your neck sits on 7 bones and your head is about 8, 10 pounds. If the muscles aren't balanced, it doesn't collapse, it falls forward. So you're going to have pretty arch, the nice pretty arch of our neck straightens up and tips forward like a golf tee holding a golf ball. And if the golf ball, we don't want the golf ball to fall off of that tee, so it all tilts to one side. And that's that turtleneck that we get when we're slouching in the wrong position. The pecs then join in and get tight, and the tops of the shoulders round forward.
Right.
This is the old lady hump that like most of the people I get like over 30 are like, I don't want to get the old lady hump. How do I fix that? It's activating your mid back and being able to stack your shoulders and your posture in a passive way. Um, some of it's some of it's hereditary. I can fight the good fight, but if you're everybody on your mom's side has that old lady hump, we have to mitigate it, not erase it. But doing rows, doing banded rows or dumbbell rows will activate that rhomboid and retract the shoulder blades.
Right.
Yes. And for women over 45, I'm going to hopefully get these numbers right. As your estrogen drops, your connective tissue gets tighter because estrogen helps feed your connective tissue to keep it plump and happy. That early perimenopausal area, it is a huge jump in the possibility of rotator cuff injury and frozen shoulder for women over 45 or 47. I don't remember which research it is, but I've seen it. It locks up and it takes a lot to release it. Weight bearing exercise helps prevent that, especially overhead pressing, overhead work. We're supposed to be primates, so we're supposed to hang from the trees. And if we lose that and go the opposite direction, you're setting yourself up for a chronic issue like frozen shoulder. So, in the best of times, in the nicest of postures, we should be able to do overhead press or lift a weight overhead, not heavy, like I think maybe 10 pounds at the most. It's a matter of keeping our posture steady and being able to keep the pecs released and the rhomboids active.
Yeah, it's so important to think about the body differently, and again, not as these isolated just areas. I was thinking, should I disclose this or not? But I think I'm going to do this in the hopes that it's helpful for people,
Mhm,
because we were talking about TMJ before, muscles of your face, neck, head, and, people who know me personally, this isn't like a big secret, but know that I had an accident when I was 14. I hit a curb with my face, um, not going very slowly. It was a bike accident going down a hill. My feet were still connected to the bike, so it hit me in the back of the head. It was one of those freak accidents, um, but I broke my nose, went to the emergency room. There wasn't anything they could really do much about it then. When I was 16, I had, corrective rhinoplasty,
mhm.
so surgery to correct this problem. I had bleeding, that had been going on for the 2 years in between. I could never really breathe, but even then, like, I have had a deviated septum that kept deviating over the years. My breathing got worse, and if you look at photos of me, or videos of me, I'm sure people can see that at times when either this imbalance, because the muscles and fascia also were affected. I actually think there's a nerve that had to have been impacted. I've had to have 2 more surgeries in the last 40 years because, again, my septum kept moving. This area, the right side of my nose got smaller and smaller, made it harder to breathe, and I had 2 more surgeries. I wouldn't recommend to anybody to do that unless you have to. It's very painful,
It is very
but
painful.
but the reason I'm mentioning this is because ever since then, sometimes I notice it more on video or in photographs, sometimes less, but the movements of my mouth have been imbalanced. Like, one side of my mouth moves more than the other, one cheek is higher, it gets knotted. I've definitely had headaches on and off since then, and jaw pain, that temporomandibular joint pain. And again, you would go to a conventional provider, and again, I'm grateful for those conventional providers, but and somebody would look at your nose and you'd be referred, "Oh, maybe we need to go and I don't know why your I was told, "I don't know why your septum keeps moving." I definitely wouldn't wanna have this done again. You would go to a pain specialist or maybe a dentist who specializes in jaw pain for that. You'd go to a neurologist for the migraines. And when we started working together, it was for the back pain, but it's I mean, I had mentioned this to you, you could see the misalignment of my nose
Mhm.
and the imbalance in my jaw and face, like, to me, it's very noticeable. I'm sure some people notice and some people don't, but your approach blew me away because you wound up not comfortably, by the way, but stretching the muscles of my face and neck and shoulders and upper back. And I have to tell you, it's made a huge difference in pain, but it's made some notable difference to me in the asymmetries. I think I probably still have nerve damage in the right side of my face, um, because I notice it doesn't move the same as the left, but it's made a huge difference. And again, it's that idea that your body is a system.
So what you're describing is the foundation of that, the impact, the age that you had the injury makes a difference because you're just starting to have growth spurts. The face, which was a child's face, then becomes an adult very quickly afterwards. And having a scar and multiple scars, as you described,
Like,
that
internally, yeah.
internally and they kept changing things. The body had to grow around that, the nervous system had to grow into that, and because it was at a really specific age, it wasn't a zero thing. The foundation could have be like you said, there's probably a nerve trapped. If you take the number three, your fingers into a number three, and put it by your ear where your jaw is, there's three branches of the nerve that feeds your face. One goes to your eyebrow, one points to your nose, and one points to your lips. If the injury and they meet on either side of the nose and other either side of the eyebrows and by the chin, so you have one on either side. If the nerve on its pathway through the face gets injured or takes impact, it has scarring. Proprioception, what your how your body realizes it's in space and moving, is integrated into that nervous conduction. So we're how we see our feel ourselves in space is really important in our jaws, in our hips or the hip flexor area, and in our ankles. Those 3 points tell your body, oh, I'm not falling down a hill, I am walking, I am standing upright. The impact you had it interrupted that, and now instead of you walking with a limp or walking with a twist, your face did the twisting, your face did the contracting, and that fascia stuck around and then grew into itself. What I did was first release the fascia, sorry.
Yeah, by the way, it's not comfortable at all, but it
No,
made a huge difference in
I
in terms of pain and alignment.
I we did cupping too, right? Did I use the facial cups on you?
I don't
I
think we
I
did.
don't think we did. Okay, so you can do facial cupping for it as well. It's the same. It's a suction cup, but a plastic cup that you can suck into the tissue and pull it away. That's an option. The technique I used is either cross friction massage, where you stimulate the collagen and break it up, and then hopefully get the blood flow to flush it away. stripping, which you take one direction of the muscle to go in that direction to help improve the collagen lay down. Because if you make a bunch of grooves, the collagen is going to follow that and lay down in that nice line. That's the techniques I use to release and correct what we were dealing with. I was aiming to take the pressure and the pull off of the opposite side because you had the impact on one side. I was, instead of going to the side of the problem, I'm trying to get the other side to help out first and then let the original side balance.
I realize this
So,
is very hard for some people
mm,
to picture, but
yeah,
the long and short of it is,
yeah,
if your body is a system.
yeah.
Yeah,
This can apply to any part of the body. I deal with C-section scars that reverberate through up and into the diaphragm, down into the knee. So I have to go start from the scar and go out, or start from the furthest point and go in a similar fashion where you're releasing the tight side, correcting the scar adhesion as it goes into the tissue and down, because it can lay like a film, or it can ball up like a spider web or cotton balls. And not everybody makes the same connective tissue, so it depends on what your scar is doing underneath. I had a person who had laparoscopic surgery, so tiny little holes throughout the abdomen, but was having trouble breathing. It was diaphragm, their diaphragm was tight, and it turns out that those little holes had a network of adhesions underneath them and up and into the diaphragm. And it's postural, because if you round and slouch into it and you're healing, you're going to put pressure on the scar, and the scar is going to lock right up around it. So,
but in that case, because again, many people, especially women, will have had some sort of laparoscopic surgery, will have
mhm,
had a C-section scar, a hysterectomy scar, depending on how it's been done.
mhm.
Is there a yoga stretch that would help balance that area for people who are
Yo-
dealing with that?
So diaphragmatic. So you think of the system of the the torso, from diaphragm to the hips, as a soda can. So if the soda can is a nice tube, uh, it's nice and happy. If there's a bow in the soda can, you have to unkink it. So releasing the tightness, which is usually the back. The back takes on more pressure, and the abs disengage, they turn off. So fish pose, or back bending, assisted back bending over a pillow or over a ball, those I usually at the when we talk about fascial release that doesn't feel great, I do scraping or gua sha over connect over adhesions while they're in a back bend over an exercise ball. That's you got to be ready for that one.
To break
But
up some of that,
to
some
break
of
up the
the
adhesions,
adhesion.
you have to scrape with a metal tool. I use a metal tool. It can be plastic, it can be jade or bone. Back in the Eastern medicine uses that. You scrape with it to bring blood flow, to break up adhesions, and to initiate the inflammatory process in a way that the body can utilize it and heal, as opposed to just triggering the inflammatory process and then not really getting anywhere with it. It's to complete it, to get from start to finish. You get it red, you get it swollen, you get it painful, and then the body corrects it.
I wanted to say too is that
Hmm.
that is also one of the things you did on my face, and again, it was
Yes.
very uncomfortable, I'm just admitting it, but I've
Yeah.
started doing it not regularly, but periodically at home,
Yeah.
and I think it actually has helped.
A little goes a long way when it comes to that region. It is very popular to do it on your jawline to help improve jaw the look of your jaw. So there is a cosmetic version of this. The therapeutic version is different. So I'm not going to tell people, hey, follow that for this. They're not equal. But you can do, if you have facial issues, you can release them by up to 3 times a week, just opening from going the nose outward and really releasing the tissue outward.
Yeah, so helpful. Liz, I wanna be mindful of your time, but I I wanna, first of all, just thank you for coming on and talking about all of these things. I think there's a lot for people to digest. Tell people your website where they can find out more about you and your husband, Dr. Hobbs, Christopher Hobbs, and where they can find out more about Montclair Performance Health and Chiropractic.
Our website is montclairperformancehealth.com. That's Montclair, Montclair, performancehealth.com. My email is drlizmphc@gmail.com. That's drlizmphc@gmail.com.
Are you
Those are
sure
the
you want
two.
to share your email?
That's fine. I don't mind. I already have it out there for other stuff, so I do answer emails
Okay.
regularly. It might be a slow turnover, but I'll get to them. And
Okay.
if it's something like I can't help, I will definitely try to find a place that I can offer the help, like send in the right direction.
Thank you.
Um,
And I'll put the link to your website in the show notes
Perfect.
as well.
Yeah.
Um, I want to thank you again so much for taking the time out of your busy day and practice to come on the show.
Not at all. It was a great time. It was a good conversation. I do have awful stage fright, so I was really worried I was going to have this like, "Hi, this is really fun, guys." So thank you for making this really comfortable.
Well, my pleasure. This has been another episode of Unpacking Possibility. If you enjoyed the episode, and I know you did, please remember to like, share, follow, leave me a comment. Let me know what you think. Let me know what you'd like to hear more about. And of course, until next time, as